saddens me as we talk about the vaccine and you ask colleagues in the emergency department and through the hospital, there is hesitation amongst dear friends of mine that would hurt me deeply if they were to get sick, knowing that the vaccine provides us with hope and a way out right now. So with that, again, thank you all for tuning in. I'm going to let our panelists, and maybe we'll start with Juanita, do a self-introduction. I'll mute myself, and then maybe we'll go Dr. Ricardo Rodriguez, Dr. Lloyd Webster, and then Will Thomas.
Thank you, Dr. D'Angelo. Good evening. My name is Juanita Fryer. I am the Administrative Director here at Trinitas. I oversee the operations and clinical operations here at the Cancer Center, specifically in medical oncology. I'm also a nurse, and my specialty is oncology for our cancer patients here.
Dr. Rodriguez, you are muted. You have to unmute yourself. That little microphone there. While we wait, Dr. Webster, do you mind introducing?
Sure. I'm Dr. Lloyd Webster. I attended New Jersey Medical School here in Newark. I am an internal medicine doctor. I work as a nocturnist, and I work very closely with Dr. D'Angelo and the emergency doctors, taking care of the current COVID patients that we have coming through the hospital.
Thank you. Oh, Will, you want to?
Hi, hello everyone. My name is Will Thomas. I'm a nurse educator here at Trinitas Hospital. I'm from Elizabeth, New Jersey. My background in nursing is emergency preparedness and critical care, and I'm happy to be here today.
Yeah. I guess I shouldn't disclose that I'm from Philadelphia. I know there's a lot of, I'm sure, Giants fans and Jets fans, but truth is, I'm an Eagles fan. So Dr. Rodriguez is going to try to troubleshoot on the phone, and while he does that, to kind of get his microphone working, we're going to get started. And again, as I said earlier on, this really is about you. Really is about the questions that you might have, the concerns you might have, and one of the biggest concerns we have right now is safety. So I'm going to kind of kick off and ask
Dr. Rod Spearman. Just real quick, we have Jessica Cohn from the county. Just like to introduce her for you. She's on.
You got it. Go ahead. I'm sorry if I missed
anything. No. Go ahead. No, you didn't see it. She just needs to say she's from Union County. There she is.
Hi, how are you? Hi, everybody. My name is Jessica Cohen. I'm the Chief of Staff here at the County of Union in the County Manager's Office. And along with the Public Safety Department, I'm heading up COVID-19 operations for the county. Thanks for having me.
Thank you for joining. So we'll start with the questions and then we'll kind of work the chat. Is there anybody else, Mr. Spearman and Rod, who I missed?
No, I don't think so. Thank you, though. Appreciate that.
You got it. So, Will, we're going to go a little bit out of order. So patients have asked us over and over again in the hospital, probably family members, how do we know that this vaccine is safe? Well, what do you say to them?
Well, I say to them now is that, because the COVID is no longer, it's not epidemic, it's pandemic, it's global, it's everywhere. It's affecting everyone, not just people of color, not just minorities, it's affecting everyone.
That's it. Yeah, so now I can see there is some music.
Oh yeah, you're on, Dr. Rodriguez. You're live now, we can hear you.
So but I cannot see all of you. Can you see me?
Yes, we can.
All right. I can see you, but I cannot see the rest. So I'm sorry for the tech. I'm a gastroenterologist that has been serving the Elizabeth and the Union County community for the last 32 years. I am an active member of the medical staff at Trinitas and currently have served as the vice president of the medical staff And my specialty, as I said, is gastroenterology, but I'm very passionate about patient education, and I am committed to bring health to our community. So this is a time where I think we have to join arms and do what we have to do to help our fellow men.
Dr. D'Angelo, you have to unmute yourself.
Well, I just had a great conversation with myself. Will, we'll kick it back to you. It's safe. How so?
It's safe in the sense that the science is, we have to let the science take over this pandemic. We have to trust the science now. We know from history that science hasn't been too good to certain groups, minority groups, Black groups, Hispanic groups. That was then. Now, because we learned from the mistakes that when I say we, the country, United States, it was the CDC that conducted the Tuskegee syphilis experiment. It was other research, National Institute of Health, that did the Henrietta Lacks research. We know now that we as a country, we learn from our mistakes by excluding people or by doing research without consent. We have what we call IRBs, International Review Boards now, that make sure that when we do things that proper ethics are applied. The science is out. People are getting the COVID vaccine. However, those who are affected by it the most because of history are not taking it. We don't want to fall for the okie doke, like, oh, I didn't take it then. I didn't take it then. I took it then when I didn't know about it, but now I'm not going to take it when everybody else is taking it. And then what's going to happen a year later or so, it's going to affect us. So don't fall for the okie doke. The science out there, we have to trust science now because of this COVID pandemic.
Yeah, I appreciate that. I mean, I think what I also think I heard you say, and anyone else can jump in here, is it's important to acknowledge our past, right? In order to go forward, we have to go back and acknowledge the things of our past as a country, as a people, in order to go forward. And I do hope that everyone knows that, there is talk that these were rushed trials, that messenger RNA is new technology. The fact is that this isn't new technology. This is a decade at least old, that it was accelerated. I hope you all know over the past 12 months, right? So not new technology, but it was accelerated over the past 12 months or so. And which is also very important, these were not rush trials. There are phase 1 trials, phase 2, phase 3. This went all the way through to a phase 3 trial with 40,000 patients in the Pfizer and over 20,000 in Moderna. So these are robust trials. Dr. Rodriguez, what do you say to your patients when they say, hey, doc, what is in this vaccine? Is it a microchip? What is it? How do you answer that?
So I think that understanding the science behind it is critical. And essentially, this vaccine is a template of information that is being injected into the body, into the arm as a vaccine, and is actually a fragment of the messenger RNA, which is a genetic material that the virus has. Now, once it has entered into the cell, certain cells from the immune system will recognize it and then will internalize this small fragment of messenger RNA and then use that to make a protein. And the protein, which is a molecule, then gets expressed on the surface of that cell. And the immune system, which is the surveillance system of our body, recognizes that cell, which has now the protein on its cover, and will make the so-called antibodies, proteins, so that if the virus was to enter our system, it would immediately recognize it and be able to neutralize it. That is what the vaccine is all about. That is the Moderna vaccine, and that is the Pfizer vaccine. So technically, just to summarize it, it's a genetic fragment of material that tells certain cells to make a protein, and then the body makes an antibody towards that protein so that when faces the virus, it can neutralize it and fight it.
Yeah. Thank you. It was funny. So I went off and I started talking to my mom the other day, and she said, "John, listen, you're a doc. I'm not. You know, you're talking about ribosomes and antibodies and antigens. I don't understand." I said, "All right, Mom, well, what about this? What about this explanation? It's a piece of genetic material wrapped in a piece of fat or a lipid, and then it's stored in a salt and a sugar. Genetic material, piece of fat, salt, and sugar. And it is just that. I think that's an easy way for us to understand it as a group. So thank you for that. Dr. Webster, how many times do we hear this vaccine is rushed? Too quick to the market. We don't know what's in it. What's your response?
Yeah. Well, it's kind of, I echo what you said earlier. It's not rushed. The technology itself is actually about 30 years old. And so it's obviously most technologies started at the bench, people in labs working on it. We first got a glimpse of it back in the SARS pandemic, which didn't affect the United States, but we thought it would. And so during that time, they really started to ramp up this technology. And then when SARS didn't affect the United States like we thought it would, the funding went away, and so did much of the interest. But during that time, they still continued to work on this technology. They used this technology in trying to come up with a vaccine for the Zika virus. In 2019, they used this technology to come up with a vaccine for pandemic flus. And then in 2020, we got COVID. And so it's not new technology, something that's been around for a while. It's just that this has been the first opportunity that we had to really roll it out. The second thing I'd say is that the vaccine itself may feel rushed, because typically what happens is when you're doing a vaccine trial, you have to enroll people. And so that in itself is usually a long process. But since this has been a pandemic and people are dying, the urgency and the urgency for people to enroll has been heightened. And so for Pfizer and Moderna were each able to enroll, 40,000 people almost immediately. And then the third thing is that because people are getting so sick, they were able to see very quickly that, okay, people who get the vaccine aren't getting sick, and people who aren't are getting sick. And so those three things allowed us to kind of roll this out rapidly.
Yeah, great points. Thank you. You are, I think most physicians, and yourself included, we wanted to have these conversations earlier, but we were skeptical too. And I think that the community, the public should know that physicians are just as skeptical, just as concerned. And we couldn't get on a Zoom until we saw the data. We couldn't talk with confidence until we've read the trials. Listen, as a Black physician, were you nervous that you were underrepresented because there was 9 or 10%? Tell us about that. What would you say about that? It was only 9% of African Americans were in the trial.
Well, I mean, we're a minority. So I don't expect it, I didn't expect it to be 50-50 or an equal percentage. I think 10% is representative. The thing that I was really looking for was to see if they were enrolling different classifications of people. So people with HIV, people who are obese, people with diabetes, people who are smokers, that types of thing. And so when I saw that they were, I felt, and I do feel confident that we have a good representation of exactly of the population. And I think, we're not genetically different, be it Black, white. It's our socioeconomic circumstances that kind of force these genetic differences, but we're all born the same. So.
Yeah, as much as the old England wanted to teach the New England that's just not true, is it? The biology is different. Yeah. Dr. Rodriguez, anyone else, or Will, or Juanita, do you want to comment on that at all? Any comments on that? Or should I keep moving? Juanita, why should we get the vaccine?
Well, as the doctor said, I trust the data, and I was hesitant at first, and when the vaccine was being developed and was coming out, at first I was like, oh, I'm going to wait and see. But as we saw the increase in cases, and as we saw, unfortunately, the increase in deaths, the vaccine for me was a light at the end of the tunnel. It gave me hope. And some sense of security for myself, and that's why I took the vaccine. So it helped me believe. It gave me it was a light at the end of the tunnel and return to normalcy, because I enjoy being with I want to enjoy being with my family again, other than within my household and recreational activity that you're not able to do now. You're not able to do.
Was there any pushback from your family, community members about safety at all? Was there, were you selling out? Did you feel like, oh, well, I heard we're going to be guinea pigs again? Was any of that pressure or no?
Yes, family and friends. Lots of my family are getting it now, but in the beginning, they want to just wait and see. Let's just wait and see. I just want to wait. I don't want to be the first.
That scares me. I have to tell you, that whole wait and see mentality. I was talking to Miss Sharon. I don't know if she's on right now, or Miss June, one of our techs and one of our environmental service. And they're good friends. And they went through hellfire with us in the emergency department, and they want to wait. And it scares me. And I almost feel like we have an obligation to get and prioritize this vaccine into our cities, into our communities, into those communities that were hit the hardest. And so that's part of what we're talking about today, and very important. I'm going to stop right now and see if there's anything on the chat. We are here to answer your questions, so bear with me. And if anyone wants to ask a live question, feel free to do that, or jump on some of the questions that we already started. So there is a few here.
John?
Go ahead.
Hi, it's Barry Levinson.
Hey, how are you, Dr. Levinson?
All right, thank you very much. I just wanted to mention, I too, in speaking to many of the people in the hospital, was surprised by some of their reluctance to want to receive the vaccine. And it seems to me that there's a tremendous amount of misinformation that's on the internet. People are concerned about their fertility. People are concerned about all kinds of things that I really have no idea where that even comes from, because there's no scientific evidence for a lot of that. And I thought I might ask other people if they've had similar kinds of experiences dealing with people who seem to have a lot of misinformation about the vaccine.
Dr. Levinson, thank you for joining. Would you just tell our audience who you are?
Yes, hello. I'm Dr. Barry Levinson. I'm the medical director of the Cancer Center. I work with Juanita Fryer at the Cancer Center at Trinitas. And I've also been involved with the Union County Fatherhood Initiative Program, which I'm a very proud participant.
Great.
So thank you, Rod, for arranging this.
Thank you for jumping on. Does anyone want to address that and had similar questions asked to them? Fertility.
Yeah, I'll address it. So Dr. Levinson, how are you? I've heard the same things. And I agree with you. There's no scientific evidence to support that. I think it's important for people to understand that this, while it's an mRNA vaccine, it does not integrate into our DNA at all. Okay, it stays inside the cell. It doesn't go inside the nucleus where our DNA is. And so there's no possible integration. It can't change our DNA or anything like that. Things like smoking, things like, too much alcohol, chemicals, those kinds of things can change our DNA, but this vaccine cannot change our DNA. The other thing that I hear sometimes is, like Dr. Levinson was saying, the fertility. There's been no evidence of that. I know that the ACOG has looked at a study where there were some skeletal variations with women who became pregnant and got the vaccine. But those all resolved, and there have been no issues since birth. There were a handful of women who got pregnant during the trials. Maybe half of them stopped and didn't get the second dose, and the others did. And again, there have been no issues. Obviously, you know, if you're thinking about becoming pregnant, maybe you want to wait a couple months. I think that's reasonable, but I don't think there's a need to not get the vaccine and to take the risk of becoming infected.
Yeah, amen to that. Anybody else want to comment, or I'm going to work?
Yeah, I just wanted to jump in. I wanted to jump in if I may.
Great.
You know, one of the things that I would say from the county's experience, I'm not a doctor. I just play one on TV during the pandemic. I'll resume my political activities after. But I would say, like, from my experience, you know, my old boss, Senator Cryan, loaned me out to the county at the beginning of the pandemic, and the county manager put me into testing. Our experience was that everything is so emotionally driven. So, you know, we would have signs, the radio kind of directing people what to do, people, you know, kind of talking to the cars, and you could tell somebody to keep their windows rolled up a million times. When they pull in, they're going to roll their window down. The same with the vaccine, where you're trying to combat, you know, information that people are reading with science. So we can look at data, we can look at research that was done, and I think that all of this is important. But I do think that there is a huge emotional component that seems to wrap around people, and it's hard to almost change their mind, even if you're speaking with, you know, science and data and reality and truth. I think that, you know, there's an educational component that really needs to speak to how emotional the pandemic actually is for people, how scared they are, both about getting sick, but also about, you know, this, you know, getting the vaccine. What, you know, from your, you know, position as physicians or in science, you know, what would you suggest to, you know, government agencies as we, our bailiwick is not clinicians, you know, so we're trying to educate people, we're trying to vaccinate people, but at the same time, we're also trying to respond to this, you know, emotional need where people come in and they're crying. They don't know, you know, really what to do. You know, what can we offer them just in terms of like the emotional support to drive them so that they can understand and listen to the data and kind of get past that knee-jerk emotional response?
This is Dr. Rodriguez. Can you hear me?
Yes.
We can hear you.
Hear me, Dr. Rodriguez? So I think education is really the key. And perhaps to those who come to get a vaccination, and I understand there's a big emotional component because what they're living through, all the fears, friends, relatives who have come to the illness. I think at that moment in time, if you explain something to them, they may not be as receptive, or they may not even hear what you're saying. Printed information is something practical, perhaps flyers with some basic points about the vaccine, about the virus, helpful. They can read and digest that information. I think as we approach education as a tool to help our people, that may be useful. It's just a thought.
Ms. Cohen, just to add on to the question that you asked, I think what government needs to do when we're looking for participants to take the COVID vaccine, especially participants of minority groups, is that we need to change the way we approach them. Instead of saying, hey, you need to take the vaccine, the approach should be, we need you to take the vaccine. And we should also educate the community that, you know, the benefit of, when you talk about herd immunity is, well, we don't want to say herd immunity, but community immunity is only going to work when everybody in the community takes it. The minority groups, the majority groups, everybody has to take this for it to be effective. And we have to approach these minority groups, I'm a member of the African Americans, that say, hey, we need you to take it. Not that you have to take it, but we need you to take it, and tell them the reason why.
Dr. Webster? You gonna say something or no?
Yeah, I agree with what everyone said. I also think people need to honestly really, especially in our community, really need to understand what an adverse effect it's having on people of color and people and minorities in general. You know, you're 3 times as likely to have severe COVID and or die if you are African American or of Hispanic of descent. And so I think that first we have to be honest with them and say, hey, you're at real risk here. But then after that, you know, we really have to kind of promote the vaccine itself and say, listen, the science is great, and not only is the science great, but the vaccine is great. I mean, you know, when they were talking about this, we were hoping for 60, 70%, you know, effectiveness. And then we got these things and they were 95% effective. And so, you know, in the Pfizer trial alone, you had, you know, out of 40,000 people, 20,000 got it, 20,000 people who didn't get the vaccine, 162 got COVID. And of the 20,000 people who did get the vaccine, only 8 got COVID. Okay, and no one died of the people who got the vaccine. So I think we really need to kind of coach people up and say, listen, this vaccine is really, really a game changer, and really kind of help people to see that it can not only save their life, but save the life of their loved ones.
Yeah, these are great points. Did anyone else want to comment on that?
I want to comment and also add, in addition to educating and promoting the vaccine, one of the things they're stating is, well, I want to wait, and they want to wait the 5 years. Don't wait 5 years. Look what's happened within 1 year. The vaccine is good. The data is good. Where it's at the end, let's hope for the best. And it is hope for us and for normalcy. But that is the fear of 5 years down the line, I'm going to get an autoimmune disease. This is what, you know, family and friends are stating. So you have comorbidities, that you need this more than waiting the 5 years.
Thank you for that. Yeah, I think another piece is we need to shape the narrative as leaders. There's a lot of leaders on this call. And one of the first things we need to do is to be vulnerable. And that is to say the following, that it's okay to be scared. Who among us hasn't gone home and said, is this the night I'm going to bring this home to my family? Who among us hasn't had a cough, felt short of breath? You know, who among us hasn't lost somebody? So I think we need to say that it's okay, say that it's normal, to feel a certain way about this disease, about being, you know, physically distanced from each other. It's very important to shape the narrative, to let people know that it's okay. And then we also need to set the tone and the expectations, as you all have been saying, with regards to the vaccine. You are going to get a sore arm after the first shot, okay? And you are going to feel achy, maybe have a fever, maybe not feel yourself, a little foggy for 48 hours. That is to be expected. 80% of us are going to feel that way. And then you're going to feel better. You can take Tylenol, ibuprofen before that second dose to help ameliorate some of that. But we need to say that, number one, it is scary, and we're with you, right? Number two, you matter to us. Regardless of your position, you matter. And what you did during all of this, I hope and I pray that you saw the solidarity through all the sufferings. I really do. I'm going to try to tackle some questions from the chat. One, Ms. Cohen, would you answer this from the state perspective? From the county rather. You know, where can we sign up locally to get our vaccine if you're not an extended family member, if you will, of a healthcare center? Anyone else want to jump in?
So right now, there's 2 ways that you can sign up. The state has a website that, you know, the state's driving people toward, where people can sign up to be vaccinated, and then they will drive your appointment at a local level with people that are using the state's scheduling system. For us at the county, I think after, just looking at unemployment and some other, state systems, that when everybody's on it at the same time, there seems to be crashes or hiccups, that we wanted our own repository of residents. And so we have our own scheduling system for residents in Union County. It's www.ucnjvaccine.org, where you can go and schedule an appointment with Union County. Currently, we're operating out of the Dunn Center at Kean University. We plan on expanding to one mobile operation next week on the west side of the county. I think from our perspective, so that's would be the vehicle to make an appointment. I think the frustration from residents would be that, since the governor opened up who can get vaccinated to the 65 plus, and then the 16 to 64 for Pfizer, 18 to 64 with comorbid issues for Moderna, there is so many people that now fit into that category that actually want to get vaccinated. So if you were to walk through the Dunn Center in Union County when we were just doing pure phase 1A, which was frontline workers, healthcare responders, it was like tumbleweeds. I mean, we really had a hard time getting frontline workers there and healthcare workers. And we were very, very, very surprised, actually. And it's right on at the campus. Everyone at the testing center was eligible to come get the vaccine. I head up the mobile crew. I was like begging everyone to come, and everybody was waiting for me to do it first and see if I lived after a week. And then they promised that they would do something. But, we did not have the influx in the beginning. So once the governor kind of opened up the phase, what we saw is that the demand just way superseded the supply. And what's happening now is that the state, they are only getting a certain amount of vaccines from the federal government week to week. So they only know what they're going to have for the following week, the week before. And so they can only dole out those vaccines to all of us that want to give residents vaccines, the week before. And so we're kind of waiting with bated breath week after week to see what we're going to get for the following week. Currently, we're somewhere in between 1,000 and 1,500 vaccines a week. It's clearly not enough vaccines to vaccinate all of the residents that now can get it and want to get it. And so I think that when, people come onto the system, we had 1,200 appointments go in less than an hour. It's like, the hottest tickets, that people have gotten. And unless you are ferociously typing and know how to navigate like the internet and can fill out your information in a split second, you're just not getting an appointment. And I think those are the things that we're talking about internally, because it's very hard for people, to even feel like they're getting a fair shake to even get an appointment when we release our appointments, and because they're so limited. So, I think from our perspective, even though, you can sign up through online through the county website, the other thing that we're looking at doing is setting up a phone system. So people who can't, especially seniors, they're not typing fast. They just want to tell you their information, that we have slots available so that you can call and make an appointment over the phone if that's more comfortable for you. And that we're doing it at times that, people who traditionally work and they're not working from home and they don't work on computers, so they're not on their computer all day checking for open appointments, that they have the opportunity, because we're opening slots at night, we're opening slots on the weekends, so that, everybody in any area that they work in, has that opportunity to, to get an appointment.
I've been checking every single day on that website. I get up at 3 a.m. and check. They have never had openings. It always tells you there's no available appointments. I go on that. I go on Essex County. I've gone on Middlesex County. None of the counties are doing anything that you can get on a website. And getting up at 2, 3 o'clock in the morning, let me tell you something. I'm doing my darndest and still can't.
Yeah, I think, just just to let you know, one of the things is that when we get the appointments for, say, next week, say, I'm making this up, but for argument's sake, if we have 1,000 appointments that we, vaccines that are coming in that we can give the following week, once we put those appointments out, that's it. So it's not something that's rolling typically. I think that would be an anomaly. I will say that, my background with Senator Crine, I really don't take no for an answer. So even when they say we're getting a certain allotment, I can be a nudge. And so we are trying to shake loose vaccines that either are being underutilized within the county or throughout the state and bring them here into Union County. I agree with you in terms of, we can do a better job. This was our first week. We could do a better job letting residents know when we're going to open up appointments so that at least there's this understanding that Saturday morning at this time, like I need to be ready, when appointments are opening so that everybody feels like at least they have an understanding and a fair shake. And I appreciate, you letting me know that. And it's definitely something that we really would want to do better because we, I'll be honest, it was like, I don't think that we were really prepared because the week and a half before, we were having trouble filling slots. And then overnight, it was like we just couldn't have enough vaccines for the amount of people that really wanted it. So we've been working this last week to say we don't want to do it that way because a lot of residents were just like, what the heck happens? We cannot get a vaccine. And when are you going to put more vaccines on? And I can't get online and I can only use the phone and I, work during the day and I'm not by a computer or I work at night and I can only do it on weekends, so that we can make sure that we are releasing appointments where we are being sensitive to, all of our residents, that we are making sure that we are, really targeting people like geographically right now. We're on one side of the county and there's a whole other part of the county. And if you don't have a car or if it's not something where you can drive in the evening, that we want to make sure that we're taking the show on the road so that we're also, responding to residents on the other side of the county. So it is something that we're working through. And, the communication aspect is certainly something we can always be doing better. And, one of the things that we try to do through our website is update it often. So I would check back and sign up for the county Facebook and our Instagram. I think they send out the announcements in real time. And I'll make sure that I circle back around that we're giving heads up to residents in that way. And I know that we're sending something out in the local newspapers because I know some people they're not online, so they might, read the newspaper. So we're trying to do it that way as well.
The only thing that really concerned me, and I just found this out tonight, is the amount of vaccines that are being discarded because they haven't used them. That's really upsetting to people who really want the vaccine, would have gone, but they're throwing them out at the end of the day.
Yeah, I can only speak for our site. That never happens. We waste.
That was really upsetting.
Yeah, we waste nothing. And I'll also say that we're not allowed to. I mean, the state is like pretty strict. We have to report in real time the vials we open, the amount of doses that we're taking out of each vial, the patients that we're inoculating up to the state system in real time. So, there has never been a day that we've been open that we've ever wasted a vaccine ever.
Okay.
Yeah,
that was upsetting.
These are excellent questions, and certainly there is reasonable emotion. I told my mom the other day that and this is a one-liner. Maybe I'm oversimplifying this. Be patient; the vaccine will find you. And as the supply matures, so will our ability to dispense it. I'm going to go through a couple of questions. One was, is one vaccine better than the other? I'm going to take a shot at this and then just to move through the questions. The answer is no. Both of the vaccines available to us right now are both messenger RNA. One is Moderna and one is Pfizer. People are asking if one is better than the other, and the answer is no. It's really about storage. One is ultra cold, -70. So more than likely, that's coming from a healthcare facility that has that freezer to store it. And the other one can be stored in there's a freezer, I think, behind you, Ms. Pearl, can be stored there at -20. So that's one of the questions. Is it safe? And does anyone want to answer anything else about the vaccine being safety, or do we all feel the same? Okay.
But the only thing that I'm concerned about is my daughter is breastfeeding, and they questioned that the safety because if it's going into the milk and going to the baby.
No. So as the American College of Obstetrics, it is safe to breastfeed. I don't know if anyone else wants to comment on that. And again, this is not DNA based, and this does not cross the placenta, nor will this affect the child. Does anyone, other doctors, want to comment on that?
Dr. Rodriguez here, if I can add a line to that.
Sure.
My daughter-in-law is now pregnant, and she's speaking to her obstetrician, and the consensus across the board by the obstetricians and the Academy of Obstetrics is that it's safe, and they are actually going to encourage pregnant women to get a vaccine. And furthermore, it's known that pregnant women are at higher risk for complications, and they can have more severe COVID if they get infected. So not specifically about lactating moms, but in general, the opinion is that it's very safe in this group.
I can actually
go ahead. I'm sorry.
No, Ms. Pearl, my wife is actually breastfeeding, and she got the vaccine, and we haven't had any issues.
Okay.
Dr. Webster, I see that Mrs. Frazier and Ms. Sessoms asked similar questions about clarification on what is meant by minorities being at greater risk for COVID.
Right.
Can you help answer that question?
Sure. So minorities, what we're seeing is minorities are at greater risk because of the underlying pre-existing health conditions. And so minorities are at greater risk for heart disease, we're at greater risk for hypertension, we're at greater risk for obesity because of, we won't go into it, but a lot of socioeconomic problems. That's always been the case. If you're talking about the fact that there are not enough grocery stores in urban areas, or the fact that, people don't have the resources to eat as healthy as they wish they could. And so it's those underlying conditions that are more prevalent in the minority community that predispose them to severe COVID.
Thank you. I just wanted that to be clarified. I didn't want anyone to misinterpret and say that because of just being African American that you're, that's why I wanted it to be clarified. Thank you.
Yeah. The Sessoms asked the same questions as well.
Will, you got another one you want to run with?
No, but I think there's a question for Dr. Levinson. Somebody asked a question about are cancer patients, are they able to get the COVID vaccine? I don't know if Dr. Levinson.
Yes, thank you for asking, and that's an excellent question because, of course, our patients, patients who are actively undergoing treatment are immunosuppressed by their therapy, and they are at greater risk of actually having complications from COVID. And we unfortunately have had patients who've passed while they're actively getting treatment. Fortunately, that hasn't happened recently, but when the pandemic began, it was a disastrous problem for everybody. As you may know, in the trials that were done, they explicitly did not want to use people who are actively getting chemotherapy, but there certainly were patients who are cancer survivors who were on the trial, people who have other immunosuppressive illnesses who are on the trial, and everybody routinely seemed to tolerate the vaccine without any problems. And I participated in a call with the cancer center directors from around the state of New Jersey, and we constantly discuss the issues about vaccination and virtually everybody is encouraging all of their patients at the cancer centers, whether they're actively undergoing treatment or if they're survivors or if they have other disease but they're not getting treatment, they still should be appropriate candidates, and it would be safe to give the vaccine, and they should receive the vaccine. So everyone is being encouraged. Cancer patients, people getting treatment, people who have been treated and remain in remission, all of those patients are encouraged to be vaccinated.
I'd just like to add that we started vaccinating our patients here at the cancer center this week, and the phones will not stop. Yes, they at all ages, I must say.
That's right. So we decided to send all the phone calls to your home. Yeah, everybody is interested. The patients, our patients are not fearful about the side effects of the vaccine. I don't believe so.
Well, you got another one that seemed to be moving it quicker than me. Keep it going.
No, I just want to think that the community, especially everybody in the community, don't see what we as healthcare workers, frontline workers see. Everybody's not tuned into CNN or Fox News. And, you know, they just hear, oh, you know, you got to be careful. You got to wear a mask. You know, but they don't know why. They don't see like the people are suffering inside the hospital. Patients are suffering inside the hospitals. Hospitals, all the hospitals are trying to do their best to take care of our loved ones when they come into the hospital with COVID. And because of, you know, the risk of COVID, there's a lot of restrictions, a lot of changes in the way that we provide healthcare. You know, we limit visitors, not just in the hospitals, but also like in nursing homes. You know, this is something that we all have to be in, like someone said earlier, we all have to put our arms together and link together to fight this and to do what we have to do to make sure that our loved ones are protected. They don't see what we see in the hospitals. They don't see the people suffering, the people alone in the rooms, you know. In other countries, when they show people that are sick, they show you someone in the hospital sick, suffering. We don't see that, and a lot of people in the community think it's not real unless they see it, like it's in their face. I know people in my community who have lost more than one family member, and that's the sad thing. For me, working in the hospital, it's sad when you have in one room a person sick, suffering from COVID, and then down the hall on another unit, you have maybe another family member from that same family dying, you know. So, you know, the people in the community who are not tuned in, we have to get them tuned in, let them know that this is something serious.
I'll grab another question from the chat, and I apologize. One of them I'm going to refer. So if you're interested in the full data set, you just simply type into Google Pfizer or Moderna vaccine, and you'll get free open access to all the data with regards to the trials. What if I get one dose? What if I get one dose and I somehow don't get the second dose? Does anyone want to tackle the risk, the benefits? If not, I'll give it a shot. I'll give you a minute.
Go for it.
Yeah, so I get this a lot. So if you get the Moderna versus getting the Pfizer, the best of times with influenza, the effective rate is around 30%, 50%. Okay, so when I first read the data set, I said, geez, why don't we get it out to the entire world with one shot? And then as I read a little bit more, well, now you know that how lethal this disease is, killed more people than the Great World War already, and it still hasn't finished yet. So after the first dose at day 7, you have about 50% effectiveness. So 50-50 chance of contracting the virus after the first dose in the Pfizer trial. The Moderna, after the first dose, it's called confidence intervals. You have between a 50% and 90% of having immunity even after the first dose. Now, the field is leveled 10 days after the second dose, and you only have a 5% chance of getting clinically sick. So, you know, is it the worst thing if you get one dose? No, you're 50% better than you were when you started. But we know that because of lethality and what we believe is the durability, we think that these antibodies or this, good guy. The bad guy is the antigen. The good guy is the antibody. The good guys will hang out longer with that second dose, and that we feel you'll be protected. We know it. It's not a matter of feeling after that second dose around 10 to 14 days later. Other questions? Anybody else want to pull one off there?
Dr. D'Angelo, somebody asked the question, do you still recommend getting vaccinated even if the person had COVID in the past?
Yeah,
You're muted.
But I said such wonderful information. No, I'm kidding. The answer is yes. And I almost started to answer it with the first question. We know the durability is better, believe it or not, in the vaccine arm of the trial. When you get COVID-19 the natural way, you would think, geez, God is smart, right? Our immune system is smart. What happens is that COVID-19 the natural way has more than just one spike. It has many different spike proteins. One of them is that the spike that we engineered synthetically, but it also has these other ones. These other spikes will cause your immune system to go down. And when the immune system is weakened or dampened, then the virus sticks around, and the virus does not provide the strength of an antibody that we are going to see when we get vaccinated. And I didn't know that until I got kind of geeked out about virology and immunology. So the natural form of our immune response is not as strong that we know as the synthetic form, because the synthetic form just challenges that one spike, tricks the body into believing that they have a COVID-19, kills it, and produces strong antibodies. And that second booster makes it more durable. It lasts longer. Go ahead. Anybody else?
Yeah, one question. They say they don't know whether you need it yearly or what. I'm assuming the trials are still going on, that it's going to determine when we need to get it again, if ever.
You said it. I mean, people, remember, this is not a terminal event. These patients that were enrolled, almost 100,000 patients, these are longitudinal trials and they're still going now. So sometimes the best test is time. As time goes on, we're going to know more and more data, and we're going to share more and more data with you all. So you're right, and you answered the question. That's right.
Someone asked in the chat, if you've had COVID, when do you get vaccinated? The answer is 3 months. 3 months after you've recovered, then it's safe to get vaccinated. And I think someone else asked, is there any wiggle room with the 28 days versus the 21 days? So with Pfizer, I know it's actually 17 to 21 days you can get your second shot. And Moderna, I'm not sure, but I would expect that there may be a couple day wiggle room on each side of that 28-day window.
Yeah, you're right. Up to 42. Yeah, so you got it. Anybody else want to pull a question? There's a couple questions about allergies. Does anyone want to tackle that? I'm an ER doc, so I can tackle it, or you all can do it. Should I get the shot? I have asthma, or I have allergies. I'll fire away. The answer is yes. Why? We treat allergies every day, anaphylaxis every day. At Trinitas, we've already administered, we put over 3,000, I think it's 3,200 in patients' arms. We have had not one anaphylactic reaction, not one. So please know that we have experience right in your backyard, right with physicians and clinicians right in front of you. And that if you do, we are there. This is stuff we do every day, treat allergic reactions. But please know that an immune response is going to look like a sore arm. An appropriate immune response is going to look like you're going to feel a little wonky for a couple of days after the second dose. Go ahead.
John, let me just back up. Another reason to if you've had COVID and you were fortunate enough to get over it, now we're starting to hear about these variants that are coming out, if you've been kind of paying attention, right? So we have the UK variant, we have the South African variant, and just yesterday or the day before at Ohio University, they isolated 2 variants that are novel only to the United States. And so while we're hopeful that none of these will escape the vaccine, The problem with, you know, with not getting vaccinated once you've had COVID is that you don't have that robust immune response like John was talking about. So if you actually have the vaccine, you're more likely going to be able to ward off any of these variants than if you just go about the infection the natural way.
Love it. Great point.
But I think this
I
is,
think-
I have a quick question to Mr. Webster's point. I think that's a lot of our concern about getting the vaccine is that there are so many variants and variables to this disease, this virus, that how do you know that this vaccine is going to cover all of it? And why would I get this vaccine now, not knowing that there can be another strain out there that this vaccine may not be covered under? Like there's too many what ifs and what could be versus what actually is.
Well, so my answer would be this. Even if the UK variant does not pose a problem to the current vaccines that we have. That's already been determined. They're still looking at the South African variant. They're still going to be studying. The second point is that because these vaccines are so agile, they're able to kind of update this vaccine as we go. So if we do find a variant that can escape the vaccine, within 6 weeks we can pivot and correct and capture that vaccine. I'm sorry, that variant. The third point is, you know, it's kind of, if we all have this kind of mentality, oh, well, I'm scared, or what if, then we'll never get this community/herd immunity. And the virus will continue to spread and it will continue to mutate. So the best thing that we can do, all of us, is to get the vaccine so that this virus has nowhere to go. And if it has nowhere to go, then it has no way to mutate.
Question about children. Have they come to a decision whether small children can get it?
Studies are ongoing. I think right now, Pfizer and Moderna are both looking at 12 and up. So I think Pfizer was from 16, to adults. Moderna was 18. Pfizer has a study now that's looking at age 12. Once they determine that it's safe in age 12, then they'll go to, age 6, and then they'll go to age, 1 or so. So it's still being studied.
Okay.
There's a question about another question about allergies, and I don't know how long we have this. It's 8 o'clock. I don't want to take up more time than we're allotted. So whoever wants to tell us to get back on at a later date, we can do that, or I can keep going. There's a question about the flu shot. If I'm allergic to the flu, should I get the COVID vaccine? That's a different animal. If the flu vaccine is germinated in hen eggs, this is completely synthetic. It does not require another live organism to generate the vaccine. So they're completely different. More times than not, you're allergic to what the vaccine is stored in. It's called a diluent. And again, I told you it's a fat, a salt, and a sugar, and most of us are not allergic to fat, salt, and sugars. Anybody else want to pull questions? Do you want to wrap this up? I'll let someone from the Interfaith Council jump in. It is 8 o'clock, or should we keep going for a minute?
I just want to say thank you. You guys have been great. I appreciate all the information tonight.
I just one more question. In addressing the mental health issue, I know there's a lot of talk about it. I don't know what is being done or what's planned to look at, or what could someone possibly do because of all the deaths and all the other issues are centered around the mental health. Anyone want to respond to that?
Well, as you know, go ahead.
No, go ahead, John. Go ahead. You take it.
Yeah, I mean, I was just going to speak to Trinitas Behavioral Health Services, and we can, get you a link to someone to talk to. I mean, there isn't a county that Trinitas Behavioral Health isn't in. I cannot give you a website right now or a phone number right now, but we can certainly get you a link. Lloyd, you want to go ahead?
No, I was just gonna say, yeah, I was gonna echo the same thing. I think it is a problem. It's a problem among healthcare workers, the amount of stress that we're all under. And so, if you find yourself in that situation, or you know of someone, definitely refer them to us. I'm not sure if there's a county or statewide website. My wife's a psychiatrist, so I'll actually speak with her, and then John, maybe we can forward something to Interfaith.
Yeah, that'd be great.
If we find something.
I'll step up on behalf of Interfaith. Rod Spearman again. I want to thank all of Trinitas and everyone in the county for coming on board. I think this really helped us and assist us, the Fatherhood Group, to just give you an update to let you know within the next several weeks, Fatherhood is planning to work with Trinitas and the county to do another Zoom event all in Spanish with the Spanish community. One of our members is taking the lead on that. And then the second thing, we're going to work with Will Thomas and Elizabeth and Ron Thomas in Plainfield and across the county to do another event for everyone. This is a long road to go forth and deal with, but thanks again, Trinitas. Thanks, Interfaith and all of you, and thanks for the county. I don't know if anyone from the Interfaith team would like to say some final words or anything.
Yeah, I'll say a brief. I just want to thank everyone, Jessica from county and the doctors again. This was very informative, and the questions I believe were great questions in earnest, and it says a lot. As we were putting this event together, I'm a pastor, and I work with the Interfaith. I'm like, oh, I've got to get this thing together, but you all are trying to put this event on and fight the virus, either by distributing the vaccine or working in the hospital. So it's a great appreciation for you all to take this time to do this and educate the community and help us out, because I know you're all working very hard. This probably wasn't the first thing on your plate, but it's an important one. So thank you very much for being here tonight.
Once again, thank you, Dr. D, Mary, all the Trinitas, everyone. I can't remember everyone's name, but blessings and God bless us all. And thank you so much. And we'll be talking soon.
All right. Thank you so much.
Thank you.
Thank you. Take care.
Bye.
Good night.
And Karma, we're going to get the recording of this, right?
Yes, I can. We're recording it. It's also on Facebook Live, and we can distribute that.
So Trinitas, Jessica from the county, and Fatherhood. Thanks.
Got it.
All right, bye, everybody. Thank you.
Good night. Thank you.
Good night, everybody. Thank you.
Good night.